Good afternoon, and welcome to this conference hosted by MS Focus, Multiple Sclerosis Foundation. I'm your host, Chris Payne, editor for MS Focus, and I'm joined by Dr. Herb Karpatkin, who will present Ask the Physical Therapist. After opening remarks, we will open it to your questions and comments. Now I'm delighted to introduce our speaker. Herb Karpatkin received his master's degree in physical therapy from Boston University and a doctorate in neurology from Rocky Mountain University. He's board certified in neurology and geriatrics and is a certified multiple sclerosis clinical specialist. He has held clinical posts at the Rusk Institute of Rehabilitation Medicine, Burke Rehabilitation Hospital, the International Multiple Sclerosis Management Practice, in addition to academic posts in the physical therapy departments of Truro and Hunter colleges. He has presented extensively, both nationally and internationally, on physical therapy and multiple sclerosis, and has published numerous articles on MS. In addition to continuing to be actively involved in patient care, he is a tenured associate professor of physical therapy at Hunter College, City University of New York, teaching courses in neurologic evaluation and intervention, psychological aspects of healthcare, and research design. We are pleased to have him join us to present on this important topic. Herb Karpatkin, thank you for being with us, and I'll turn this over to you.
Well, good afternoon, everybody. I want to start off by thanking MS Focus for giving me the opportunity to speak about physical therapy and multiple sclerosis. I've been, as Mr. Payne just said, I've been working in physical therapy for over 40 years, specializing in multiple sclerosis for most of it, excuse me. And I find one of the best ways to educate people with MS about how physical therapy can help them is just by letting them ask me questions and letting me answer. So here we go. I'm ready for your questions. Please fire away.
All right. Just a reminder for those of you who have been here before, and as a note for those who have not, if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you, and then you will be able to unmute and ask your question. And our first question for you comes from Stacy. What are the best things to do to improve balance? I am okay in good lighting and even ground, but when the lights are dim or I am dealing with very uneven ground, my balance completely goes away and I feel like a drunk person. What exercises can help prevent my knee from giving out on me? I am normally okay, but at random times it just goes. Thank you.
Sure. Well, first, thank you for that question. And that is actually a fairly common complaint, and it really shows some of the specific nature of multiple sclerosis. You said that when the ground is stable or when the light is good, your balance is good. But when the ground is unstable or when the light is bad or both, your balance gets worse. And that shows two things. One is that you're very visually dominant for balance, meaning that you rely a lot on your eyesight for balance. And two, that probably the sensation in your feet is probably impaired because you are having trouble sensing uneven terrain. The exercise program that I give for somebody like this is relatively straightforward. First, if you're having trouble balancing in low light, what you need to practice is balancing in low light. Okay? So what I recommend you do is, what I start most people off with is I have them stand in front of a stable surface. I have them very, very lightly touch the top of the surface, barely touching if at all, and then close their eyes. And that way they have to practice balancing without light. There's no strengthening exercise or stretching exercise you can do. Your brain has to relearn to adjust to how to balance with low light. So balancing with eyes closed and a light touch, maybe have a couch or your bed behind you, so in case you lose your balance, you can just sit down. That would be one of the first exercises I would recommend. For balancing on unstable surfaces, it's a similar thing. Um, uh, Probably the way I start most patients off at home for balancing on unstable surfaces is I have them stand on a cushion or a pillow, because that is very unstable. They do it first with their eyes open and then with their eyes closed. But to put everything more simply, if you're having trouble balancing with low light, you need to practice balancing with low light. If you're having trouble balancing on unstable surfaces, then you need to practice balancing on unstable surfaces. This is a really common finding in MS, and most patients who take on these exercises notice an improvement within a couple of weeks. Thanks for that question.
All right. Our next question comes from Yasmin. How do you get your insurance company to cover this? And I'm assuming by this she means physical therapy, but maybe there are other issues that are involved as well.
Yeah, I'm assuming physical therapy. I mean, first of all, it's not easy. The insurance company is really not our friend. And I won't go into my very strong feelings about that. But if insurance denies you, what the insurance company is hoping for is that you won't fight it. And what I spend a fair amount of time doing is contacting insurance companies and advocating for my patients for them. So you, your PT, your physician, the nurse has to be very proactive in dealing with the insurance company. All decisions that an insurance company makes, with very few exceptions, is subject to appeal. So if they say, no, it's not covered, it can be appealed. And what I tell my patients is the insurance companies hope that you're not going to appeal it, because if you appeal it, that means more work for them. So the insurance companies will often deny, but they also don't like to fight with you. So put up a fight so you can get what you need.
All right. Our next question is coming from Mary. Mary, can you hear us?
Yes, I can hear
Next
you.
question, please.
I have an exacerbation about a year ago that attacked my left leg viciously. And I'm just coming back. I'm receiving Botox treatment. And I just recently started to be able to straighten my leg, but my knee will not straighten all the way. How do I get that to straighten?
I'm sorry, I only caught the second half of that question. Can you repeat it, please?
How do I get my knee to straighten all the way?
Well, what was keeping it from straightening?
I had an exacerbation about a year ago, and my leg was curled up like from the knee all the way up to my thigh. I was in like the fetal position permanently. And so I've been getting Botox treatments, and that's helping somewhat, I think. Recently, I've been able to stretch my leg out all the way, but my knee is not straightening out all the way. How do I get to do that?
So Mary, I'm really sorry we're having some technical issues. I'm only getting some of what you're saying. Can you repeat the question one more time, please? I'm very sorry. So you
How do I
haven't,
get my knee to, my leg to straighten and the knee to straighten with my leg?
does it, does it not straighten because it's tight or because it's weak? Is the leg sort of locked in
It's,
being bent?
it's tight and locked. I've recently only been trying to, been able to straighten it, but my knee, it's like, the knee is right there. The bottom is stretching. I can feel it stretching up in my thigh. And just the knee
Okay,
is not cooperating.
I get it. So can you tell me how you stretch?
I stretch my legs and I sit in my wheelchair and I roll back and I stretch my legs out. When I lay down or when I'm sitting, I just sit back and stretch my legs out all the way. But the knee does not bend, does not straighten.
Okay. How long do you hold the stretch for?
I hold it as long as I can.
But does
Could
that
be a
mean,
minute, 2 minutes.
okay, and how many times a day do you do that?
At least 5 times a day.
Okay. And when you lie down on your back, does the leg go straight or does the knee stay bent?
The knee stays bent. I can lay down on my back, but my knee stays bent and it turns inward. It's my left leg
Yeah,
that
yeah,
turns
I
into my
get that.
right leg.
Yeah. Okay. Um, is there anyone or can you put some weight on top of the leg, on top of the knee? So there's
Okay.
something pushing it down.
Yes, my
Does
husband,
it,
he's been exercising my leg.
oh,
He's like avoiding my knee. So he
okay,
needs
so
to press it
here's what I
down.
recommend. Lie down on the bed,
Hmm.
okay, and have him put his hands right on top of the kneecap and super gently push down. Just push just enough so that you can feel the stretch, but no more. Okay, because the amount of stretch, it sounds like you're stretching enough. It doesn't sound like you're stretching hard enough. So if your husband can just put his hands with a little bit of force, trying to push the back of the knee down into the bed, and then hold that for several minutes. Okay? Because if you're doing about 10 minutes a day, that's a decent amount of stretching, but it sounds like it wasn't enough force. An alternative is to get some kind of a cuff weight and put it on top of the knee and let the weight of the cuff weight push the leg down.
Okay, thank you.
Okay, thank you.
Thank you. Our next question comes from Addie. I have numbness in my left hand. Exercise. I have numbness in my left hand. What exercises can help with that?
Well, it's really hard to say because I don't know what the numbness is from. Um, Probably the most definite thing I could say is the more you use that hand, the better the better your sensation will get. It's a common scenario in MS that a person gets numbness or tingling or weakness or stiffness in their hand and they stop using it, which makes whatever was going on in the first place worse. The hand gets weaker, the hand gets number, the muscles of the hand get tighter. So the most important thing you could do in this situation is to make sure you use that hand as much as you can. Okay, so many people, if they're, you know, if one hand gets numb, they stop using it and use the other hand. That actually makes the first hand get worse more quickly. So you need to, excuse me, you need to make sure you use that hand a lot. Use it to, for dressing, for feeding yourself, for combing your hair, for washing, but you have to use that hand as much as you can.
All right, our next question comes from Michael. What kind of exercises benefit MS to help with balance issues?
Well, that's a very generalized question, and um, obviously, with you asking it, it sounds like you obviously have some balance issues. Um, but I can't tell what they are. Probably the simplest way to answer that is to figure out what kinds of situations do you tend to lose your balance in. So for example, with a large number of the MS patients I see, they balance pretty well with their eyes open, but they tend to lose their balance with their eyes closed. So that's what I make them practice. Or they tend to balance really well if their feet are wide apart. But if their feet are close together, they lose their balance there. So that's what I have them practice. Or they balance really well on stable surfaces, but on uneven surfaces or unstable surfaces, say like thick carpets, they tend to lose their balance. So that's what I have them practice. So what I recommend is you try to figure out what kinds of situations do you lose your balance in? And those are the kind of situations you need to practice.
All right. Our next question comes from Janine. I hope I'm pronouncing that correctly. I exercise, but I never seem to get stronger.
Is that the whole question?
That's the whole question.
You exercise, but you never see. Well, first of all, hard to answer because I don't know what kind of exercise you do, and I don't know what you're hoping to accomplish with it. But the purpose of exercise for MS is more than just to get stronger. I have many patients with MS who are quite strong, but strength is not their problem. Their problem is balance or coordination. Okay? So first of all, probably a good idea to lose the idea that the purpose of exercise is to get you stronger. I think of MS as a disease of mobility. People have trouble walking and balancing and what have you. So the exercise programs that I give are not to get people stronger, but to practice the things that they're doing badly at, such as walking or balance or climbing stairs or going downstairs, etc.
Just a reminder, if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you are on the phone. I will call on you and then you will be able to unmute and ask your question. Our next question comes from Michael. Actually, it's more of a comment. He says, "Thank you. I will apply that to my situation. I will define where I lose balance. Thank you. I will pay attention."
Very good.
Our next question. Janine has responded. "I want to get stronger, increase my endurance. When I climb stairs, my legs hurt."
Okay. So I kind of need to know why they're hurting. The problem, though, of increasing endurance is a very typical one for MS, and that's because the most common MS symptom is fatigue. So it's hard to work on endurance because when you work on endurance, it gets you fatigued. So actually, some of the research that we do at Hunter College looks specifically at that. People with MS try to improve their endurance by working for longer and longer periods of time. But because of their fatigue, they can't do that. So what I recommend patients with MS do is rather than working continuously, work intermittently. So instead of trying to walk, say, for 10 minutes without a break, walk for 1 minute and then rest for 1 minute, walk for 1 minute and rest for 1 minute, etc. So if you're having trouble with stairs, maybe just try doing 2 or 3 stairs at a time, then rest for a minute, then do another 2 or 3 at a time and keep going that way. Because the most important thing is the amount of practice that you do. So instead of doing as much as you can without a break, do very small portions of exercise, taking breaks between it. That way you'll be able to practice more, and that will help you to improve your endurance.
Very good. Actually, I'm going to take a little, I'm going to insert myself here a little bit. I do have a question. When one is working with a physical therapist, when they offer a program for that individual, is that more of a like a prescription, or is that or does that get offered as something else?
Can't hear you, still frozen.
The question I had is when a physical therapist offers up a program for therapy for that person, for that individual to work on after the therapy session, is that a prescription, or is that sort of a set of guidelines for them to follow?
Ideally, it should be a prescription. So MS, as I'm sure everyone here knows, is very, very individualized. So you can't give generalized exercises. So when I see a patient, I give them a home exercise program that's very specific to them. It's a definite exercise prescription. The idea is to give them an exercise program that's perfectly matched up to their needs due to their MS.
All right, we have another question here. Question from Anonymous. What are the best exercises for spasticity in legs?
Ugh, that's a tough question. Let me try to answer that. So spasticity is a fairly common symptom in multiple sclerosis. It's a type of stiffness that comes not as a result of the muscle itself being stiff, but the brain and or the spinal cord is sending messages to the muscles to contract when they should be relaxing. So there's no exercise that can make spasticity go away, but there are a couple of exercises that will limit spasticity or limit the effects of spasticity. One is really just gentle moving the muscles in a really relaxed way. No hard, fast, strong movements. So one thing that a lot of my patients do to relax the spasticity in their legs is they put their feet up on an exercise ball and gently let it rock from side to side. Okay. And that tends to relax. The other thing is the spasticity can make the muscles in the legs tighter. So you have to very carefully stretch those out, or the leg will simply get tighter and tighter over time. So gentle relaxation and prolonged gentle stretching is probably the best thing. But usually the best treatment for spasticity is medical, a drug called baclofen, which most of my patients with spasticity is on.
Just a reminder, if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you are on the phone. I will call on you, then you'll be able to unmute and ask your question. And our next question comes from Anonymous. How much time could be spent on a recumbent bike at a time, and how gradual to add minutes?
As I just said, MS is so individualized that it's going to be hard to say. Some people will spend, an hour a day on it. Some people can only do a few minutes. Generally, the rule I try to give to my patients is to at least build up to 20 minutes 3 times a week. So, but it doesn't have to be 20 minutes continuously. You know, you could get your 20 minutes by doing 3 minutes on, 2 minutes off, 3 minutes on, 2 minutes off, as long as you get your 20 minutes. Okay, so the other thing is the intensity. It should be hard enough so that you elevate your heart rate, but not so hard that you have trouble catching your breath. So, you know, I just try and get my patients to simply move their legs for 20 minutes 3 times a week, and telling them it doesn't have to be done all at once. It could be done in 2 or 3 or 4 minute increments.
Our next question comes from Mary. What is considered a gentle stretch?
Very good. What is considered a gentle stretch? So the way most people with MS think about stretching is they stretch something really as hard as they can. It hurts and they hold it for 15, 20 seconds and that's it. That's usually counterproductive. What you really need is to stretch the muscle so you just feel the pull of the muscle. And then you hold that for a long period of time. A long, sustained, gentle stretch is going to be more effective at improving your range of motion than a short, intense stretch. So just enough so that you feel a gentle pulling and no more.
The next question comes from Kathy. Is there an online virtual option for MS workouts when your insurance limits your PT sessions?
I think there's a group called the MS Workout. I don't even know. Here, let me see if I can look it up right now. But there is, excuse me, there is a MS Workout online site. Yeah, it's called msworkouts.com. And it's really more of an exercise program than a PT program, but a lot of my patients have found it to be helpful.
I actually want to piggyback on this question for a moment because we addressed insurance at the top of the session, but I don't think we actually addressed Medicare. How does Medicare sort of interact with physical therapy?
Well, Medicare does pay for physical therapy for people with MS. The problem that I hear from my patients is not getting Medicare to pay, but finding a therapist, who takes Medicare, who is training in MS. So a lot of my patients who go to Medicare, who get Medicare and use it to pay for their physical therapy, are dissatisfied because the therapists who they work with don't have training in MS. So before you start with a Medicare covered therapist, you should contact them and make sure they do have some training in MS. It's in the same way that for your medical care, you go to a neurologist with specialization in MS and not a dermatologist. You have to make sure you find a physical therapist who has some training in multiple sclerosis.
Just a reminder, if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you and then you'll be able to unmute and ask your question. And our next question comes from Anonymous. What are the best exercises to improve gait?
Oof. Well, again, without knowing exactly what gait problem you're looking for help with. The biggest, so over 90% of all people with MS do have complaints about their gait. It's one of the most common findings, but it can be different for different reasons. It could be a foot drop, it could be sensory loss, it could be weakness, it could be spasticity. So the type of exercise program is going to depend on the type of symptoms your MS shows. That being said, the most important thing is to keep walking. Okay, and keep walking as much as you can. So I would rather somebody walk a few minutes every day than have them not walk and do lots of exercises instead. A MS patient of mine who walked fairly well was unfortunately in a car wreck a few weeks ago.
Mm.
And he's okay, but he broke some ribs and he was pretty bruised up and he didn't walk for 5 or 6 days. And he's having a really hard time getting back his walking. And I'm really pushing him to try to do that. It's not like he's in pain, it's just he lost the practice of walking. And so it's again a fairly common scenario that people with MS, their muscles will get weaker or tighter, so they'll walk less, which will make their walking worse, which will make them walk less, which will make their walking worse, etc. So it's this vicious circle. So I can't tell you exactly what exercise you need because I haven't seen you, but I can tell you the most important thing is to keep walking.
All right, our next question comes from Margie. Margie, can you hear us?
Yeah, can you hear
Chris,
me?
you're frozen again.
Can you hear me?
Yes, I can hear you.
Okay, a doctor told me to get an MS certified physical therapist. They're kind of hard to find. They definitely do help and do know what they're talking about. And Mandy Moves, I put it in that chat. Mandy Moves and Emily Riley. You can Google that because Emily Riley was diagnosed at age 17 and she's, works out. She actually comes to Fitness Fun for MS once a month. And it really does help when people who have the disease tell you what to do because they know what you're talking about. But
Yeah.
when you're talking about where you lose your balance, I have scoliosis besides the MS.
Oh boy.
Everything it's never boring. This is not a boring disease. But it's a bad because I do have one of those those little bicycles that you can either put on the desk or put on the. I mean, should I be walking more? I have to use a walker or a cane. So should I be spending more time using the rollator or the walker or doing the bicycle thing?
Well, again, without examining you specifically, it's hard to say, but as a general rule, if you want to keep walking, you got to keep walking. So the biking is good. It'll get you a little bit of cardiovascular fitness. It'll get some movement in your legs, but exercise is very specific. You get good at what you practice. So if you do a lot of biking, it's going to make your biking better. It's not really going to improve your walking. So if you want to maintain your walking, you got to practice the walking. At this point, I'm not sure it matters that much whether you use a rollator or a cane. But the main thing is that you do something and you do as much of it as you can. And as I said before, one way to make sure you get more of it done is to do it intermittently. Instead of walking as far as you can in 20 minutes, try to walk 2 minutes on, 2 minutes rest, 2 minutes on, 2 minutes rest. That way you can walk a longer distance with better quality.
Yeah, well, let me ask you, I take one of those, it's not really a rollator, it's like a walker. It doesn't have the wheels on it because it's too heavy car. But is it better to do one that just has those little like ski feet on it or one that has tennis balls on it? I mean,
Uh,
does I
The
was
ski feet, yeah, I know what you're talking about. I like the ski feet better because the tennis balls tend to wear out on the pavement more quickly. The ski feet are more made for that. Um, the I'm not a big fan of the tennis balls.
But now doesn't really have the ski feet. It's got just like a little circle in the hole at the bottom. Because I don't know, where do you take that to get that out to get the ski feet on there?
Any decent physical therapist should be able to. You have to order the ski feet.
Yeah.
But any PT should be able to pop the pop the old ones out and put the ski feet in.
Well, it's not ski feet, it's just like a circle that
Oh,
fits in.
I understand that. I understand that. But so you probably have to purchase the ski feet yourself, but
Yeah,
you'll probably need some help getting the old stoppers out and the ski feet in.
yeah. Okay, well, I'll take it to the physical therapist, but like once a year you should go get checked out, is what I've always heard. You know,
For
get it or whatever, right?
your physical therapy. I would say more often than that.
Really? And
Well,
will it cover
MS
it?
can change so quickly. MS can change so quickly. So, um, uh, what I tell my patients is at least every 6 months, and they should feel free to, I have my patients call me and say if they think something has gotten worse, let's arrange a meeting and I'll examine you right then and there.
But now when you were talking about where you lose your balance, specifically, you're supposed to do more different kinds of exercises where you would lose it. Is that what you were saying earlier?
Pretty much, yeah. So
You're frozen.
difficult for you. Okay, so if you want your balance to get better, you have to challenge your balance. And this again is a really common thing I see with my patients. Their balance gets worse, so they stop trying to move so much because they're afraid of that moving will cause more balance loss. And so the less they move, the worse their balance gets. So what I try to push my patients to do is to intentionally put themselves in positions where their balance is a little bit challenged and have them hold that position, for 20, 30 seconds a few times a day.
I
But
want
if
to
you
thank you, Margie. We do have to move on, but I do want to thank you for participating. We really appreciate it. Our next question comes from Barb. I stopped baclofen because it makes me sleepy during the day. I do stretching of the calf. Am I hindering my tone in my leg by not taking the medication?
Well, that's a common problem people with baclofen face, um, because it is a sedative. It will make people a little bit lethargic and sleepy. Um, the first thing I would want to know is whether is how big a dose you are taking. I found that many of my patients can go down on their regular dose, but still get the effect. So I have some patients who take as little as 5 milligrams a day, or less even. And that is not sedating, but it does decrease their spasticity somewhat. There are also other medications, non-baclofen medications for spasticity, which some people find to be less sedating than the baclofen itself. So you should speak to your neurologist about that.
Just a reminder, if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you and then you will be able to unmute and ask your question. Our next question comes from Sharon. When sitting, I have a hard time lifting my right leg up due to weakness. Are there exercises to make it stronger?
Well, again, I'm not really quite sure. Do you mean straightening your knee or lifting your leg or pulling up your toes? Hard to say. I guess if you can't do it in sitting, can you do it in lying down? Can you do it while you're lying on your back? Okay. And if you could do it that way, maybe you need to practice that quite a bit first before you try to get in sitting.
All right, our next question comes from Denise. I have sciatica, scoliosis, along with MS. My walking, balance, and standing are all bad. Are there specific exercises I should be doing? I've tried baclofen and it seems to make me worse. Which medication do you recommend?
Oh, there's a lot there. Can you read that one more time, please?
I certainly will. I have sciatica, scoliosis, along with MS. My walking, balance, and standing are all bad. Is there specific exercises I should be doing? I've tried baclofen and it seems to make me worse. Which medication do you recommend?
Well, as a physical therapist, I can't prescribe medication. I'd like to know how it made you worse. Usually, one of the first things that makes me think is that you might have had too large a dose of baclofen and it made your muscles floppier than they should be. The baclofen reduced the tone too much. In terms of what exercises, I don't know, but because I haven't evaluated you, but what I can tell you is you have to try to maintain your mobility at all costs. So walk as much as you can. Try to practice your balance as much as you can, as some of the ways I specified earlier. But the patients who, because their MS seems to be getting worse, who stop moving, those are often the ones that scare me the most, because it's not the MS by itself that's making them worse. It's that the MS leads to inactivity, and the inactivity makes the MS symptoms worse, which leads to more inactivity, et cetera, et cetera. So you need to make sure that you keep your body active. I wish I could give you more of an answer to that, but I don't know how the spasticity and scoliosis are affecting you. There's an infinite number of ways that it can.
I have a question for you. I'd like to expand on that. What counts as activity?
Anything that is not sedentary. Okay? So the MS loves it when you don't move. If you just sit in a chair and don't move. And as I just said, the lack of movement will actually make the effects of the MS worse. So I urge all of my patients to walk as much as they can. If they can't walk, either because the disease is too bad or because the weather is too bad, I'll urge them to ride a stationary bike. But the most important thing you could do is move. Being sedentary is almost guaranteed to make your MS symptoms worse.
I'm pretty sure that there are probably some individuals who are on right now for whom PT is fairly new to them. What should they expect when they come into the office of a physical therapist?
Good. Glad you asked. So you should expect the PT first to take a history as to how the MS is affecting your mobility. What physical tasks are harder for you? Walking or balance, standing up, rolling over in bed, getting into the bathtub, etc. Then the physical therapist should do a full evaluation, examining your strength, your flexibility, your sensation, your coordination, and then seeing how your problems with strength or flexibility or sensation have impacted your ability to move. Then the physical therapist should prescribe a very specific program tailored to the problems that you have. Okay. I've unfortunately heard too many stories about somebody went to a physical therapist for their MS. No evaluation was done. The therapist put them on a stationary bike and had them lift some weights and then said goodbye. That is bad physical therapy. So this goes back to what we were talking about before, that you have to find a physical therapist who has some experience in working with MS.
And what questions, just as they should probably have questions when they go in to meet with their neurologist, what prep and questions should they have when they come into the PT's office?
Great. First question is, how much experience do you have with MS? How many patients like me have you seen? What are you going to do for me? Okay. If they just give you a generic treatment that doesn't seem to be related to their specific needs, it may not be the right PT for you. You should also ask them to give you a home exercise program, something you should be practicing on your own. And you should also work with the therapist to figure out what your goals are. What are you trying to accomplish in physical therapy? I try to tell my patients, don't tell me I want to get stronger. Tell me what you want to get stronger for. Do you want to get stronger, so you can, walk to the supermarket and do your shopping and walk back? Do you want to get stronger so you can lift your grandchildren up off the floor? Do you want to get strong enough so that you can pull, dishes and cups out of a high cupboard? So you have to be able to tell your physical therapist exactly what you're trying to do. And that way they'll best be able to help you.
And that leads me to Anonymous's question here. Is there a website that lists PTs that specialize in MS?
There is. I'm glad you asked. You have to go to the website of the American Physical Therapy Association. And from there, there's two different places you can go. One is just going to say, find a physical therapist. And then you could say where you are by your zip code or your city and what you're looking for. A PT with specialization in neurology or multiple sclerosis, and they can give you a list. A second way is to go to a part of the American Physical Therapy Association website called the DDSIG, which stands for the Degenerative Disease Special Interest Group Clinician Locator Map. And they will give you a map of the United States where all the people with MS expertise will be located. The third way, which is something I do a lot of, is just reach out to me and I'll try to help you find somebody. I have a lot of contacts all over the United States, and very often after one of these calls, people contact me and said, I'm looking for somebody in, the San Marino Valley or in Nebraska or in Omaha, Nebraska, or New Jersey. And if you give me what your zip code is, I can help you find one. I can help you find a PT pretty easily. That's something I'm very happy to do and I do a lot of.
Our next question comes from Anonymous. How many times a week should an MS person do weight training, and how many pounds?
How many times? I would say probably no more than 3 times a week. How many pounds? I don't know. Depends on how strong you are. I have one patient with MS who's a power lifter, and he lifts hundreds of pounds. I have one woman with MS who's in her 90s, and she lifts 3-pound weights. So it should be enough so that you could do 10 reps with good form and be recovered in a minute or two. But it's also going to depend on what lifts you're doing and how the MS has affected you. In terms of frequency, I would say no more than every other day.
Our next question comes from Margie. Is standing better than sitting for MS? When I'm
Yes.
in the kitchen fixing dinner, should I stand or sit?
Well, the answer is, of course, it depends, but the more you sit, the tighter your standing muscles will get. Now, it doesn't mean you have to stand all the time. If you're making dinner, and you want to save your energy for something else, it makes sense, to sit down while you're cutting the vegetables or stirring the pots or whatever. But you can sit too much. I was working with a patient earlier this morning who almost never got out of her wheelchair, and she really wanted to stand, and we tried to stand her up, but her leg muscles were so tight from all that sitting that she couldn't do it. So it's okay to sit to give yourself a rest, but beware of sitting too much because it will make your muscles tighten and make standing harder, standing and walking harder.
All right, our last question comes from Bevan. When is aqua therapy best, or is it the best?
That's a good question. I personally am not a big fan of aquatherapy for most people with MS. It's helpful in that it provides a environment in which a lot of people with MS can move better and get more mobility. The weightlessness makes the energy cost of water less, or the energy cost of walking less. So it helps you move, and movement is always better than not movement. Here's the problem. Walking in water does not improve your ability to walk on land. Walking in water improves your ability to walk in water. And in real life, you walk over dry land. So I have patients who spend a lot of time working out in the pool, and they love it, and it makes them fit, but it doesn't improve their performance out of the pool.
And while that is our last question for the day, Yasmin asks, how do we contact you?
My email is herberpt@gmail.com. And try and put it on the screen here. Hold on. Okay. And I'm very happy to answer questions about MS. This is what I do. I got a few emails last week, which I didn't get around to because I was on vacation, and my wife told me to stop doing work while I was on vacation. And I try to listen to her as much as I can. But if you have questions about MS or finding a therapist near you with MS experience, please feel free to reach out to me.
And with that, that brings us to the end of our time. If you missed any part of this conference, it has been recorded and will be available through the MS Focus Facebook and YouTube channels. Reply to your registration email for information on how to access recordings or sign up for our newsletter to learn about upcoming events. Be with us next time when our teleconference will be Continuing the Conversation, Can We Reverse Disability in MS? Presented by Dr. Ben Thrower on September 10 at 4:30 p.m. Eastern. Dr. Thor will be talking and answering your questions regarding multiple sclerosis. As you leave the conference today, a survey will appear on your screen. We ask you to please take a moment to give us your feedback on this program and your suggestions for future topics, so we can be sure to provide you with the best programs possible. Our sincere thanks to all of our attendees for your participation, and especially Dr. Herb Karpatkin. Thank you so much for the time you've spent preparing to share this information with us.
Thank you, and thanks to the MS Focus for arranging this excellent program. Take care, everybody.
Have a pleasant afternoon.
How do you register for that Ben Thrower stuff? Do you know?
There will be if you receive our teleconferences, teleconferences email, it will be in there, and it is also on our events portion of our website.
And what's your website? Because it shows up on Facebook every now and then I register, but I don't know.
Let me try this again. Our website is msfocus.org. And then just click to events and it will take you right there. Thank you very much, and we wish you the very best. Have a pleasant day.